we're going to learn things that will propagate throughout society. You know, how you really maximize impact is through the power of research and learning that can be taken elsewhere. Technology has that possibility of making care more accessible, cheaper, more affordable, and really doing that on a very broad scale.
Well, I think it's one of these situations where we have promises and perils. And so the promises that are exciting to me have to do with the fact that we have some new technologies and techniques that are allowing AI to do things that we've never been able to do before.
I'm really excited about the potential for AI to actually advance health equity, to be able to actually solve some of the problems that the most underserved communities have been facing for the longest time.
There's such a mismatch between the demand in our society for mental health services and for the supply that we're able to give in terms of our workforce. And I'm hopeful that AI can be a tool that's helpful to people and then be able to free up provider time to just see more patients and to do a better job meeting the demand that we have in our field.
I think what excites me about the future of AI in healthcare is the potential for AI to pull together multiple data sources to kind of paint a fuller picture of our patients.
I really love this idea of figuring out ways to translate lived experience into data, and also designing not only with and for populations, but also when we implement these systems, implementing them in ways that communities are able to participate in and control and influence how those technologies get deployed.
We aren't creating tools just in isolation to just put upon our patients or our community, or let alone our doctors or our nurses. And so the stakeholder engagement throughout the pipeline of AI development isn't something that just comes on the back end when you want to kind of shove it into wherever you need to use it, but it's a fundamental principle of community-based participatory research, whatever that may be, but it's throughout the entire design.
Are we making sure that it is accessible for those most underserved communities and those that are historically marginalised? Because if it's not, then they won't only be underrepresented in the data and have the problems that come with like bias, but also it means that they get to miss out on, and they have to miss out on all the incredible things that AI could really do for them.
What concerns me is when we talk about the future of healthcare, a lot of people interpret that as new and advanced technologies. And I'm a primary care doctor, and we still use faxes. And what I don't want to see is a bigger gap be established between those who have access to resources with a lot of new technology and potential, and those who are kind of stuck back in the 80s like we always feel.
Because I see every day in the efforts that we have in our community, the way that people use the information we give them and the tools that we provide to better their own lives, I feel like this is just an enhanced tool that's going to help them do that even more.
Tools that we develop to serve the most vulnerable populations will make healthcare better for all of us. And if we don't develop tools for those communities, we're really missing the mark and we're perpetuating the problems that we already have. So we, this community here, researchers, community-based organizations, healthcare providers, engineers, all have to be part of the conversation so that we think differently about not just how to develop AI, but why.